Okay, hello everyone. Today we're going to be talking about coronavirus and the recommendations and precautions for high school for both athletics and spectators. Okay, so first a quick overview of coronavirus. So coronavirus, also known as COVID-19, is a disease caused by a virus called SARS-CoV-2. The first reported case was December 31st of 2019 in Wuhan, China. Wuhan is a city in the center of China that has a wide range of transportation links, meaning there's very, very high number of population. There's a lot of movement, a lot of transportation, a lot of things going on in the city with a lot of people. So very easy to transmit. And we'll get more into the transmission later as we go through the PowerPoint. So there is no evidence of the origin of the virus, so we don't know where the virus originated from. We don't know where exactly the first person to come in contact with this virus was, what region, what country, etc. All we know is that the first reported case was in Wuhan, China. So there could have been many cases prior to this, but we just don't have the evidence to prove that, or to prove that Wuhan had the first official case of coronavirus, which is very doubtful. So symptoms for coronavirus. So there are multiple symptoms that may be active at once. These include, but are not limited to, fevers and chills, cough, shortness of breath, difficulty breathing, fatigue, muscle, body aches, headaches, loss of taste and smell, sore throat, congestion, runny nose, nausea, vomiting, and diarrhea. The two most common popular symptoms of this virus would be shortness of breath and difficulty breathing, and loss of taste and smell. So just a little bit of statistics on this virus. So since January 21st of 2020, there has been a total of 34,412,532 confirmed cases in the United States, according to the CDC. Out of all those cases, there has been 608,528 deaths in the United States. This accounts for 1.76% of mortality rate. So even though the mortality rate is not huge, it's still a very large number that we can prevent and hopefully, as time goes by, bring down with all these precautions and safety protocols. So transmission, so this is how the virus spreads. So COVID spreads when an infected person breathes out droplets and very small particles that contain the virus, and these are inhaled by another person or land on their eyes, nose, or mouth. In some circumstances, surfaces may be contaminated when an individual touches the surface. People who are less than 6 feet from the infected person are at greater risk of becoming infected. This is why we tell people, cover your nose, cover your mouth when you sneeze, when you cough. Ideally, you would like to cover these areas with your elbow. Why your elbow? You touch a lot of things with your hand. So let's say you sneeze into your hand, you cough into your hand, and you have the virus on you. Sneeze into your hand, you go ahead and touch a door, a table, a wall, something. It doesn't matter what it is in a public area. That area is not contaminated. Someone else has the higher risk now of coming in contact with the virus. So very important to keep this in consideration. If you're gonna cough, sneeze into your elbow, sneeze into your shirt, somewhere where it's gonna prevent, or it's not gonna be as easy to transmit this into someone else. Three main ways that COVID spreads. Breathing in air when close to an infected person. When close to an infected person who is exhaling small droplets and particles that contain the virus, having small droplets and particles that contain virus land on eyes, nose, or mouth, especially through sprays like a cough or a sneeze. So like I mentioned earlier, you want to avoid sneezing into your hands because you touch a lot of things. Sometimes you shake people's hands, and you can transmit that a lot easier than sneezing into your elbow or into your shirt. Touching eyes, nose, or mouth with hands that have the virus on them. So this is what I'm talking about whenever you transmit to someone else, touch someone else, and you pass the virus onto them, into their hands, and then a lot of people touch their faces a lot, touch their eyes. Sometimes their eyes get itchy, they scratch their eyes, their nose get itchy, touch their nose. A lot of things going on that people go to their face for, and that is a very easy way to also come in contact with the virus. So it's just important information of COVID. If one is not fully vaccinated and 2 or older, individuals should wear a mask in indoor public places. In areas with higher numbers of COVID-19 cases, one should consider wearing a mask in crowded outdoor settings and for activities with close contact with others who are not fully vaccinated. Outdoor, non-crowded settings do not require masks. Now we're going to get into vaccines. So these are just methods to help or reduce the higher risk of coming in contact with the virus or possibly becoming very ill with the virus. So there's 3 vaccines currently recommended by the CDC. First one is the Pfizer vaccine, which is 2 doses. There's also the Moderna vaccine, which is 2 doses. And we have the Johnson & Johnson vaccine, which is a single dose. People are considered fully vaccinated 2 weeks after their second dose in a 2-dose series, such as the Pfizer or the Moderna, or 2 weeks after a single dose vaccine, such as the Johnson & Johnson vaccine. So what this means is that, let's say you take the Pfizer or the Moderna, right? You get your first dose, you gotta wait 2 weeks. You're still not fully vaccinated. You take your second dose after those 2 weeks, you're still not fully vaccinated. You must wait 2 more weeks after your second dose to be considered fully vaccinated. The difference between the Pfizer, Moderna, and the Johnson & Johnson is that specifically, that Johnson & Johnson is a single dose, so you take 1 dose of the vaccine. 2 weeks later, after their first dose, you would be considered fully vaccinated. If not vaccinated, the CDC recommends the following for unvaccinated individuals. CDC recommends and highly encourages to wear a face mask when in a crowded area, to stay 6 feet away from others, wash your hands often. CDC encourages you to get vaccinated, monitor health daily, and to clean and disinfect areas often, especially areas where we come in contact with a lot. It could be doorknobs, it could be our cars, it could be our cell phones. You know, we place cell phones on tables, and who knows how many people have been in that table before in public areas, whatever the case may be. Always trying to stay disinfected and clean, especially with your hands. Individuals affected by COVID-19. So the general public is affected by COVID-19. The thing is, there are several categories of people that are at higher risk of severe illness. And these categories would be older adults, which would be 50 years or older, people with medical conditions, pregnant and recently pregnant people. Severe illness means needing hospitalization, intensive care, or a ventilator to assist in breathing. Unfortunately, this severe illness could eventually lead to death. Back to the medical conditions. So the medical conditions that increase risk of severe COVID-19 illness are the following. You have cancer, you have chronic kidney disease, chronic lung disease, which include COPD, asthma, interstitial lung disease, cystic fibrosis, and pulmonary hypertension. You also have dementia and other neurological conditions. You have type 1 and type 2 diabetes, Down syndrome, heart conditions. Along with those heart conditions, you have heart failure, coronary artery disease or hypertension, HIV infection, immunocompromised state, which means a weakened immune system, liver disease, being overweight or being obese, being pregnant, having sickle cell, being a smoker or a current former smoker, having a solid organ or a blood stem cell transplant, stroke, cerebrovascular disease, or if one has a substance use disorder. All of these mentioned increase the risk of severe COVID-19 illness if one comes in contact with the virus, and it could lead into the hospitalization and the need of ventilation, like I mentioned in the last slide. So now we're going to get into why students should come back to school. And some of the reasons are that there are a lot of negatives when students are away from in-person classes. So to name a few here, we have Virtual learning can be a problem since not every student has access to electronic devices or internet. Not everyone has the resources to purchase a laptop, to purchase a phone, to purchase a computer. Nonetheless, if they can't afford one of those electronics, they'll probably not be able to have internet at their home. So it's a little bit of a disadvantage for some of those students who are not at the same socioeconomic status as maybe students who do have these resources. So bringing them back to school gives everyone an equal opportunity. At-home learning allows for distractions to students to lack engagement in class. A lot of distractions going on. A student could just, join the Zoom call and not even turn on their camera and just wander off and be on their phones, be watching TV, sleeping could be another thing that could make them lack engagement in class. And along with this, with missing engagement in class, not being so engaged, and a lot of distractions, it allows for students to be, it allows for students to miss more assignments and homework or instructions from teachers. So, our school goals for education. School goal is to include school goal includes having students come back to school in person. We want to help students graduate and advance to the next grade level. Learning in school is more efficient than at home, allows for more engagement and less distractions. More school engagement leads to improved academic grades. Vaccine is strongly recommended for students to have a safer learning environment, so we would like for students to come in vaccinated. Obviously, we can't make everyone get vaccinated, but it is just strongly encouraged so everyone feels safer and everyone's more encouraged to come back and learn and become more educated as they go on with high school. And like I mentioned earlier, our goal is to also allow equal opportunities for students regardless of socioeconomic status. So now, why have athletics? Athletics are important for funding the school and the sport program itself. Whenever we have athletics, purchasing tickets, purchasing from concession stands, all of this goes towards the athletic programs, and it helps with uniforms, equipment, it helps with fundraising, you name it, right? These programs need these funds. If we don't have those funds, unfortunately, we may have to get rid of some programs, and we don't want to do that, especially to the kids who have been participating in those sports. Another reason we want to have athletics is we want to provide opportunities for students who may have the ability to move on to the collegiate level and have scholarships awarded to them if they have the talent to go on, and they get their school paid for. And it's a great opportunity for students to continue their education and have something to motivate them to go on to college. So, school protocols for athletics. This is for athletes. So if a student athlete at the high school level claims to be vaccinated, they must show documentation to the athletic department for evidence. Individuals are encouraged to wear a face mask when in class and when walking around hallways. Classes and hallways are always usually more than likely very populated, especially hallways when students are moved from class to class. There's a lot of movement, there's a lot of contact, there's a lot of very close proximity between students moving around. So we will encourage the students to wear face masks, especially during the transition from classroom to classroom. We also encourage it during class, but traffic is not as crazy between classes as it is during class. When traveling with school, face mask is encouraged but not mandatory. In the buses, if you're going from one school to another, we will encourage it. It's not mandatory, and if there is an unvaccinated student, we will highly recommend for the student to wear a face mask. No face masks are required on the playing field for the players. If the student is out on the field, on the court, on the swimming pool, and they're competing in swimming or diving, like they don't have to wear face masks. They can, but they're not mandated to. Just so they can be more comfortable playing. They don't have stuff in their face blocking their eyes, whatever the case may be. If an individual would still like to wear face masks, though, they're more than welcome to. If coaches and staff are not, or if coaches and staff or staff are not vaccinated, face masks are strongly encouraged to protect students of disease and possible health issues. So if you're a coach or you're a staff that's going to be around the athletics, we highly encourage you to, number one, get vaccinated. And number two, if you don't want to get vaccinated, just be considerate of the kids, be considerate of the families, and wear a face mask. If a student athlete is not participating in game at the time, face mask is encouraged unless equipment sport does not allow easy access. So if a student is sitting on the bench during a basketball game, during a soccer game, during a baseball game, we encourage them to wear their face masks, just to kind of promote the safety and to keep everyone safer. Now, obviously, it's a lot more complicated when a kid has a football helmet on. It's not, we're not going to push it as much for those football players because having the face mask on and having to take it off, and it's a lot of things going on for those students, and we're just not going to push it as much if the equipment does not allow it to be efficient. No post-game handshakes routines between competing schools. So, for example, baseball game, after the game is over, usually you see two schools meet in the middle and they shake hands, good game. We're not going to allow that. Maybe just, from a distance, wave at each other, good game. That's it, just to avoid unnecessary contact. And post-game sanitation of the facility will be done. So we will have staff go out there and clean, for example, the dugouts in a baseball, after a baseball game. We'll have staff go out there and clean the benches during or after a football game, after a soccer game, so on and so forth. So school protocols for athletics, this is for spectators. So if an event is indoors, face masks will be required for spectators. If outdoors, not required. It's recommended for unvaccinated individuals to wear face masks outdoors in outdoor events, since usually, there's multiple families around, and it's just to, like I said earlier, keep everyone safer. Only 2 spectators per player will be allowed for both indoor and outdoor sporting. This is just to limit traffic. It's to limit possible risk of more or multiple people coming in contact with the virus if, for whatever reason, someone with the virus happens to attend the game. We just want everyone to be safer, and it's easier to socially distance with a smaller crowd. So sanitation areas will be available at the entrance, exit of the facility. We encourage you to go ahead and bring your own sanitation, whether it's Germex, baby wipes, whatever makes you feel comfortable, whatever will help you stay clean. We go ahead and encourage that as well. No post-game gathering, photography inside facilities. So, for example, a basketball game, we are going to go ahead and ask for parents or guardians to just, as soon as the game's over, please step outside the facility. We're going to clear the facility. If you want to go ahead and take pictures out there, if you want to meet up with the player out there in a home game, you're more than welcome to. But we don't want a lot of traffic and a lot of gathering indoors. If the event is in another location, let's say another school, then we're going to have the students board the bus immediately after the game. After they're meeting with their coach, we're going to board immediately. We're not going to have a lot of time to take pictures and socialize and gather post game. So immediately to the bus. Precautions. So every day before practice and competition, athletes will be asked a few questions in regards to signs and symptoms. So we're going to take their temperature. We're going to see if they have any of the symptoms listed here. If they do, we're going to send them home. We're going to get tested, and if we suspect anything that could potentially be COVID related, we're just going to send them home. So athlete testing. So we're going to have tests, COVID testing for the athletes, and it's going to be the day after their weekly competition. So tests will be done the following day in the mornings. If the athlete fails to show up to the test, they will be listed as positive and will not be allowed to participate in the next athletic event. So it's important for these athletes, for these students to come and do not miss their tests. Because if they do, they're going to have to wait a whole week to be able to participate in the next game, next event. In the case that an individual tests positive, athletes will be sent home to quarantine for the recommended time by the CDC, which is 10 to 14 days of quarantine, or 7 days after a negative test. Recommendations outside school: recommend we stay clean, sanitize areas before sitting in public areas to eat, study, etc. Try and keep everything clean, wipe things down before you sit down, after you get up, so on and so forth. Sanitize hands, wash hands. It's the most vulnerable area of the body since we grab a lot of things, we reach out for things, we touch a lot of things. We do a lot of things with our hands that make us very vulnerable to viruses, bacteria, and diseases. Avoid large crowds if possible. If you don't have to go out to somewhere where there's going to be a lot of traffic of people, don't. If you do, recommend that you wear a face mask. Last but not least, we recommend you get vaccinated. It's the best way to avoid coronavirus severe issues. And those will be my resources.